Well, hospitals in the Texas Medical Center are stretched to surge capacity, and to add insult to injury, there's a shortage of nurses. Stephanie Whitfield spoke with the Houston ER nurse about why staff is stretched thin.
There are several factors at play here, but the end result is the same. Fewer nurses are treating more patients, and they're exhausted after facing COVID-19 on the front lines for a year and a half. Many Houstonians are concerned watching COVID-19 numbers sharply rise again. Kevin McFarland has a front row seat to what doctors call the fourth wave of the pandemic.
Healthcare workers throughout the country are tired. We're working hard. While the city is debating about masks, we're just trying to make sure that we're keeping everybody safe when they come through those doors.
McFarland is part of the Houston Emergency Nurses Association. Not only are ER nurses exhausted, they're also short-staffed. He says many are leaving local hospitals to make more money as travel nurses. It's one of many factors contributing to a shortage of nurses at several area hospitals.
What I think we're seeing is some people who are leaving nursing as a profession. I think we're seeing a little bit of that. And I think we're seeing lots of nurses who are real tired. So I think some of them are opting for different positions.
Positions with lower risk of exposure. That COVID fatigue is something we can all relate to. This ER nurse asks everyone to act like they did last year, because from his perspective, not much has changed.
COVID is still a problem, and there's a lot of folks that think that maybe it's not. And it's just not true. We're still feeling COVID here in the emergency department particularly.
Another reason hospitals are noticing this shortage of nurses is last year, crisis nurses came in from all over the country to help, and that hasn't happened this summer, Xavier.
Yeah, Stephanie, really great job, great reporting, really the entire pandemic. That's something, though, that we heard about this morning from Congresswoman Sheila Jackson Lee, right?
Yeah, she says that she sent a letter to Governor Greg Abbott asking him to request more crisis nurses come to Houston. She held a news conference earlier today, and she says so far FEMA has only received one request from the state.
The only request that we have from the state of Texas are 5 mortuary trailers, and that is to take the dead bodies of those who have died and succumbed to COVID.
The Congresswoman says that request has to come from the governor's office, and so far, it hasn't happened. In the medical center, Stephanie Whitfield, KHOU 11 News.